but we do have two remaining speakers. Barinder from Keeping Well, Northwest London. There's quite a lot going on there, so that will be good to hear about. And also we've got Selena Doherty from Skills for Care. So Selena will get her full time, as opposed to sometimes we do seem to be unfortunately cutting Skills for Care short. I will just say that there still seems to be a lot of COVID around. I was invited to another meeting this morning, which I couldn't attend because of this. And I've had an email a few minutes ago to say that that too has been cancelled because a facilitator has gone down with COVID. And the figures, although the government is trying to tell everybody it's fine, there are still a lot of cases of COVID about. So a lot of people catching COVID. So it is wise to take precautions, particularly as we're in social care and dealing with vulnerable people. Another quick point, I was asked about using these meetings as CPD. You don't need us to produce a certificate for your CPD portfolio. You can simply log it yourself, and put on there what you've learnt and your further plans. Now, Dudley is having to leave shortly, so he's got a few things to say, and I think he'd also want to cover people joining up to WhatsApp as well. Dudley.
Thank you very much, Peter. And there's so much going on, but it's funny, we've come in the middle of half term where you have half in, half out. So I appreciate people who are actually attending today. I think, as we understand, Peter made a good point about COVID and actually being taking precautions. I think it's also important as well, as the summer months increase and the holidays come up, there's a lot of mingling as well that happens, and we sometimes forget that things can get passed around very easily. So still do take care when you're out there, and looking out for your fellow colleagues as well. Thanks as well, Peter, as well. I think it's important as well, with so much going on with retention, recruitment, technology, mental health, well-being, that we also have to keep up to date with various small things. We know things such as audits, and as well as we know the sector's filled with lots of businesses, is also keeping on top of your audits and so many things. So it's glad that Selena's here. There's a lot of things that Skills for Care are doing, and as Peter said, Selena gets to rush through so many things very quickly. Unfortunately, we don't get a chance to touch on some of the great things that Skills for Care are doing. But also as well, during this period, there's a lot going on, but also there's lots of access to courses. We also understand that now that some of the MVQ sort of students will be finishing as well. So please do look out for those finishing your courses anywhere locally in your local colleges or even schools, and that you might be able to attract to actually bring on board as well. So there's a lot going on there. And yes, I know we'll be touching on with things such as keeping well and the mental health, which is also a massive area as well. There's been a study that emergency service and frontline sort of care services are 30% more susceptible to mental health concerns than the average everyday person. So also do bear that in mind with your staff. Think about your rotas, and also think about your staff and how they're working. Time out, flexible working. It's really important to really bear that in mind. And it also helps with recruitment and retention as well, because every staff member now is looking to be in a place where they can actually get some downtime, and value and being valued is also a key factor. So if we look about that as well within your own settings, it's really good to see, and CQC do like that when you're actually showing that you're actually thinking about your staff in more ways than one. So that's also important. But the culture of the organization, I always say the leader sets the tone of the organization. So it usually mirrors what you're doing. So I'm not saying take a good look in the mirror, but actually it can also be support actually your staff that's there. But also as well, delegation is also important, actually helping those, give other people roles, support where they can also support working to the management sort of structure. We are not islands. And from what I see a lot of the time, I get to speak to a lot of providers. It seems like they are. You've got staff that's there. Selena also tell you the wonderful about the deputies chairs as well. So deputies are also very important as well, to give them actually some sort of, they can give you some support. Even events like this that you may not be able to attend, if you want to go on holiday or away, you actually, deputy chair can actually stand in as well and learn about that as well. So I think there's a raft of things. I would turn around and say it's also as well just keeping up with sort of like the news. Peter and I do as much of a good job as we can, and Selena and Skills for Care, to update you with what's going on. But things may be more specified to your local area. So do look out for any form of funding, training, and providers as well. Do speak to one another. I feel it's one of the things that we do really badly, especially now we're so busy. Actually, you're all professionals, you're all leaders, and the experiences of yourselves actually help those along the way. And finally, before I sort of like jump off of the amount of things I'm going to throw at you, we are kindly looking at a little pilot at the moment around retention and recruitment that we're looking at in Wandsworth and Richmond. Hopefully it's about how staff work, how they're recruited, and the things that we can do. Peter will probably share some information around that. And we hope that if we can really get that to be successful, it might be an ongoing model as well. So do look out for that. Anyone who's in Richmond and Wandsworth area, we will be actually coming to you, and it's all free funded sort of support on retention and recruitment. You'll get stats, figures, all the sort of things that you probably may not be looking at. So do look out for that. And I think apart from that, before I take up too much of everyone's time and bore them to death, I'm going to pass it over to Peter, and then I think I'm not sure who's in order first, whether we're going for either Selena or Barinder. So I'll let you do the toss up for there, Peter.
Okay, thanks, Dudley. Interestingly, I've just had a phone call from a guy at the King's Fund. They're doing some work with DH about hospital discharge. He's going to come back and have another conversation later on today, but we are aware that there are issues around hospital discharge. So if you've got any points, please do let me know, because they're always useful. And we have had various conversations with the DH and with the King's Fund to try and get information and get your views passed on. Dudley mentioned the recruitment funding. The recruitment funding has actually been given to us it's a grant from Skills for Care. It's a short-term pilot that we need to use the money wisely, but in swift time. As Dudley mentioned, we're focusing on Wandsworth and Richmond, but we will also be doing some other work with the other Southwest London boroughs. So if you want to know more of that, please let me know your name, your company name, and a phone number so that we can contact you. Put it in the chat. We will put our email addresses in the chat as well, so that you can contact either Dudley or myself. Makes no odds. We will both sort it out. And that project is being run in cooperation with an organisation called Purple Tribe, who are pretty much the market leaders in
and indeed of social care, Peter, as someone quite likes to say that who they are.
Quite. Okay, we'll come back to that again later in the meeting. But I think it's probably wise if we go with Barinder first. Barinder is from Keeping Well Northwest London. The Northwest London Keeping Well portal is open. It's been funded for a couple of years now, and is going into at least another year. Although it says Northwest London, there are a lot of people using it who are outside of Northwest London. It is a useful and valuable resource, and it's free. So make use of it. Pass the information on to your staff, to your colleagues, to your friends. It's a huge amount of stuff on there, and I'm sure that Barinder will tell us lots more about it and is happy to take questions. Barinder.
Thank you so much, Peter. Hi, morning, everyone. My name is Barinder. It's lovely to be here this morning, and thank you for having us. I am one of the CBT therapists that works in the Keeping Well NWL team. What I'm doing this morning is I just want to talk to you a bit more about what we actually do, and how you can benefit from our service, what it is that we offer. And then I'll give you a little overview of our actual website, the sort of portal that we have that's accessible with lots of free resources and information that is really valuable for yourselves and also for your staff and as teams as well. So I'm just going to share my presentation. Just bear with me while I bring that up.
And while she's preparing it, I would say I've been doing a lot of work with Keeping Well since the pandemic. And one of the things that it was looked at was actually the support of the sort of health and social care staff as a result of COVID. So please do sort of utilize it as much as possible. Thanks, Barinder.
Thank you so much. Yeah. So we are, I think, I mean, hopefully we are quite, we were set up in sort of the aftermath of COVID to support staff, and we are continuing for at least another year at least. In terms of who we are, for those who haven't heard of us, we are Keeping Well. We provide psychological and wellbeing support, and that's for health and social care staff in Northwest London. As Peter said, we cover Northwest London. That includes NHS staff, health and social care staff as well. So that includes yourselves and your teams, but we also support London Ambulance Service staff as well, and that's across the whole of London for London Ambulance Service staff as well. A little bit of background, I know it's been spoken about already. We are a wellbeing hub, so that's covering Northwest London. They were set up in the stages of the pandemic to support NHS staff and social and healthcare staff in the midst of what was a very, very unique time in many ways, quite a stressful time, a time where staff were adapting to very new ways of working and having to do that very, very quickly. And those were managers to kind of support workers, all levels. People were having to adapt and change their ways of working that many, had been established for many, many years. And I think we know in this sector, when change comes, it can often be something that happens slowly. It can be piloted, talked about. And in this instance, there was a lot that was rapidly overhauled pretty much overnight. So there was a lot that staff were managing. These groups of staff were also continuing working through that, going into work. So the service was really set up to try and prioritise these staff members, be able to engage them, provide assessment for staff. And the idea was that staff were to get that support rapidly. So while staff obviously can access support through the NHS, these hubs, so Northwest London Keeping Well, we offer a rapid assessment. The idea is that people will be seen very, very quickly. And I'll talk a bit more about that, what happens when people get referred. We then provide onward referral or care coordination in a kind of broader sense to ensure that staff who do refer themselves to us are followed up, linked in and supported as quickly as it can happen and smoothly. Sometimes, as you may well be aware from those that you support in your day-to-day jobs, getting access to services and support can come with a few road bumps. There can be barriers. There can be sometimes some issues that might be to do with maybe communication or perhaps paperwork. So we are there to help ensure that the journey to support is smooth for staff. And if there are road bumps along the way, we can support with that until staff are embedded into some support, whatever that might be for them. We support 8 boroughs, so that's the Northwest London boroughs. So you can kind of see at the bottom there, they're highlighted, but that includes Ealing, Hammersmith and Fulham, Westminster, Brent, Harrow, Kensington, Chelsea. That's our remit, so staff working or living in those boroughs. In terms of what we offer for individuals, so We offer specialist signposting and information, so that includes self-help resources. I'll be talking you through that in a little bit more detail on our website, but in a broad sense, anyone can access these just by logging onto our website. There's a lot of information, it's categorized and for any level of kind of difficulty or challenges from clinical diagnoses or to things that might relate to your teams in the workplace, like stress or burnout as well. We have resources on there, as well as those are kind of video resources as well, webinars that you can access. We also provide advice and support. So it might be that a manager's concerned about their staff member and they can give us a call. We could provide a bit of advice about what we can offer or what might be helpful in terms of next steps. We provide onward referrals. So once we've assessed somebody, we will provide an onward referral to either NHS services, third sector, it might be a specialist service that we have links with, like a charity, for example, that provides a certain support service that we think is appropriate. In terms of our assessment, so once someone's referred themselves to us, we do aim to see people and offer a rapid assessment. And by that, we mean we generally aim to see people the same week. So if you do refer somebody or they refer themselves or you refer yourselves to our service, we will try to get you seen by myself or one of my colleagues over the phone. So it's a telephone assessment, get you booked in at a time to suit you, to have a chat about what's going on and discuss your referral and do an assessment over the phone. These last about 30 to 40 minutes. And from there, we'll have a think about what our next steps will be to link you in with support. So that support might be priority access to IAPT services. That forms quite a big bulk of the work that we do, is getting staff referred out to IAPT. If you're aware of IAPT or not aware of them, I'm just going to give an overview of who they are. They're the Increasing Access to Psychological Therapies teams. Each borough in London has their own service, and we have an agreement with those in North West London that those that we refer, the staff members we refer, are seen as priority, and I'll come to that and what that actually looks like shortly. We also offer care navigation. So if a staff member who has referred to us is embedded in, for example, a secondary care team, or they require that support, we will kind of do our best to try and ease some of that communication to maybe might be finding out what's going on with a referral, or to speed that along and try and communicate the information that we're aware of that may have been shared with us in assessment with your permission. We do also have some offers that are very, very popular actually, and that's with our in-house mindfulness practitioner, who his name is Peter Helmer, and he is a wonderful mindfulness practitioner, and he offers mindfulness sessions. Those are free for anyone to drop into. We have a Zoom link on our website. They are, I believe, every Thursday. Anyone can just drop in. You can access live mindfulness every week. He also offers a group that runs I think about every 6 weeks. And that's a group that requires a commitment of attending monthly. Again, it's free, and that's a mindfulness group. He also offers one-to-one sessions as well, if you'd prefer that. So Peter's details are on our website as well, if you search mindfulness, and that's available to yourselves and your staff as well. We also offer long COVID support. We are aware, I'm sure many of you may have come across this as well in the sector, that a lot of frontline staff were impacted by COVID to higher levels than other members of the general population. So we offer long COVID support for staff, and we have groups that run so staff can attend. Again, there's a commitment to that group. It's the same group every week, and there's that available running. I think the next one starts in June, July. So we are currently recruiting for that as well. If you know of anybody that might benefit, that's available. And there's another group we are currently running that is not on this slide, and that's the burnout group. So burnout group is for any staff members that may feel like they are overwhelmed, burnt out. It's different from stress. There's some things on our website about the differences between stress and burnout, but it may be that they've lost their motivation, maybe lost confidence in themselves, in their role, and sort of perhaps maybe even questioning the impact of their role. That may be appropriate in that case, that person could be referred to us for an assessment for burnout group. It is a commitment. It's the same people in the group. So there's a really nice opportunity to meet other people who work in the NHS and social care sectors, and get some support, some strategies, and that's run by one of our CBT therapists and assistant psychologists. And lastly, we also offer follow-up. So again, if we are making referrals, we will check in usually about a month afterwards to make sure that the referral has actually been processed, that the person has heard back from the people, that whoever it was, the organisation we've referred to. And if something has not been moved along, at that point we can sort of jump in and try and find out what's going on. So the idea is that people don't kind of just get referred to something and are sort of left to it, if you will. And we do have the resource to follow up and check that people troubleshoot effectively if that is what is needed, to make sure that people are being seen, or that they have been able to make contact with whatever's been recommended and agreed. So in terms of individual support, that was sort of an overview of that. We also offer support for teams and organizations. We have an academy. These resources are specifically for managers, and they're for teams and organizations, and they're all about employee well-being and what you can do to better support that and optimize that. We also have consultations with teams available. We do also offer support if there has been an incident, for example, if there's been trauma in the team, if there's been a loss and the team might be struggling to process that. We do also offer an opportunity where one of our psychologists may be able to come in and facilitate a conversation about that with the team, support to process what has happened. We also offer presentations, wellbeing workshops for teams. So we've done some before, and we are running some in the future. So if you feel like your team may benefit, we have various topics. They can be sort of tailored if they sort of fit into the kinds of topics we support with, anything related to wellbeing. But for example, some of the ones we've done are around work-life balance, stress, burnout. We also have group mindfulness sessions available with Peter also. So if you would like to run a group mindfulness session for your team, it might be that you're having a team day or away day, etc. You can inquire. We can try and work out with Peter's schedule and availability for him to attend, and also facilitate that for your staff team as well. We also run something called Wellbeing Champions Training, and this is specifically for managers to be able to support their teams as well. Sorry, that's Wellbeing Conversations Training. There's also Wellbeing Champions Training, which is for anyone, and that is to attend and train up as a wellbeing champion themselves, and recognise the signs of good wellbeing, be trained up in sort of optimizing that as well. So if you are interested in any of those, you can contact us. There is more information on our website. One of the main offers that we have is related to the IAP teams. So this is kind of what I was talking about before when we talk about individual support that we do and referrals to IAP services, the increasing access to psychological therapy teams. The agreement that we have with Northwest London services with the IAP teams is that if we make a referral for somebody, if we do an assessment, and we feel that therapy would be helpful and appropriate for them and they agree, then we directly make a referral to IAP teams and they would treat those referrals as priority. This means that the staff member would, in a sense, bypass the wait list, and wait lists at IAP services can often be anywhere from 3 to 6 months or more. Most of our staff members who do get referred through us are often seen within 3 to 4 weeks and set up with a therapist. So it's a really useful offer. It does allow for us to do the rapid assessment, but then also link in staff for quick support. And this includes CBT, but also other wide range of support options as well, with support for things like depression, anxiety, PTSD, OCD, also psychodynamic support, which might be more kind of processing of something that's happened, or just to keep in mind as well, if anyone is referred to our service, it doesn't have to be a work-related issue. I think sometimes there is that assumption that we only support if it's work-related, or we do support with work-related things like burnout, but it can be anything. It can be something going on in your personal life, anything that's impacting your well-being or might be impacting your staff's well-being that you're aware of. Doesn't have to be work-related. They can be referred over to us. In terms of how you're accessing our service, so in terms of getting through to us, there's a few different ways. It does say live chat there, but we've recently disabled the live chat, so we don't have live chat anymore. That wasn't being used as frequently recently, so we've kept in our kind of most efficient ways of contacting us, and that is by giving us a call. We have a line that's manned 9 to 5. If you don't immediately get through to someone, we will call you back. We also have a self-referral form as well, so staff can directly refer themselves. You can also refer a staff member to us, but of course it must be with their permission. But if they agree, then you can refer that staff member, send us their details, and we will then contact them directly, so they don't need to do anything. If they agree they would like some support and they would like us to contact them, and they agree you can share their details, you can do that and we will contact them. And we do get referrals that way that come through supportive managers who send the details over. And you can also request a call back from us as well. There's a few different ways to get hold of us. That's kind of a very broad snapshot, and thank you for listening, of kind of what we do as a service, what we can offer you and your staff teams, and how to get hold of us. Before I say my goodbye, I just want to say thank you very much for listening, but also thank you to everyone so far who's participated in something that we're running at the moment, which is our staff health and social care staff wellbeing survey. We've had some really great response to it so far. And for those of you who may not be aware of it or haven't taken part yet, it is still running. It's a survey that essentially replicates what the NHS already does, which is a huge survey NHS-wide to look at what's going on with staff wellbeing. Because if we don't ask, we don't know what the issues are. And this is an opportunity for your sector to do the same. So we have a survey. There will be a QR code sent out. I'll be sending these slides over with the QR code to Peter. You can just access that, fill it in. It's really short and quick. We did initially have Amazon vouchers, £20 Amazon vouchers that were snapped up, and we had lots of responses. They are now all snapped up, but we are still getting responses coming through. We would really appreciate your insights, because only you know what works well for your teams and what are the challenges. And it's only once we have that information that we can shape support that is appropriate and meaningful for yourselves and for your teams. So thank you for all of those that have completed that so far. Thank you, Selena. I know you've been really pushing that as well. But if you haven't and you could share it with your teams, that would be really wonderful. Thank you so much for listening.
Great. Thanks, Barinder. Very useful. Any questions?
Can I make a quick point, Barinder, because
Yeah.
I've been part of just Keeping Well sort of work that's been happening. It's been really invaluable, and it's been happening up and down the country, and I think it's quite tailored to various areas, which is quite personal as well. I think one of the things I found is a lot of staff, especially dom care providers, staff, it's very hard to get them together in one go. Is it possible for someone to go into the service with time arranged to speak with them as well, and the possibility of that as well?
Yeah, absolutely. So one of the things that we do a lot of is attend, for example, staff meetings, or maybe an away day, for example, because as you said, it's a time where staff are often actually together, which, can be challenging. So if any team feels like that would be helpful for us to attend, we certainly can do. It is a part of the work that we do. So you can pop us an email, that can be arranged, and we can tailor what we speak about, or maybe offer in the meeting to anything that might feel more relevant to your team specifically.
And the other thing I think that people forget is a confidential space for each organization, so no information will be shared. I think a lot of the time some providers are worried, or staff members are worried that information is going to be shared or be put on their record as well. So
yes, yeah, and I think that's an important point to mention. That certainly is one of the concerns that does come up. The service that we offer is confidential, and it isn't shared with any staff teams, managers, etc. It's purely it's confidential, and that's it's kept that way from the assessment point to whatever staff support that they engage in. It's about support for the staff member. It's not to do with, for example, occupational health processes, etc. We are entirely separate to that. That is not the kind of remit of the work that we do. So yeah, thank you for touching on that. And it is, of course, all free. There isn't any but sometimes we do have questions that is there a certain level of support we can access, and then perhaps at some point there's further that's optional, paid for, etc. The support that we have available, the groups, etc., they are free for staff to access. The mindfulness, burnout, long COVID, all of that, the one-to-one referrals, they are free, and yes, they're confidential. Thanks.
Karim, your question.
Thanks, Peter. Morning, and Barinder, thanks very much for speaking about this. I think it's not nearly enough higher up on the agendas usually for people. So thanks for raising this. And I think the work that you guys are doing looks really, really insightful. Something that we all probably are very familiar with, certainly in residential and nursing homes, are sort of champions in health and safety, champions in hydration, and what have you. And not nearly enough do we talk about mental health champions. And I think clearly a lot of work has been done by you and your team in formulating I guess this resource, this Keeping Well Academy, looks like a really useful pack. Is there a guide that operators can sort of download so that we can digest everything from a job description of what this champion might handle, not handle? Because often I find that the mental health champions are the really good gatekeeper to the signposting for the next step, because they're not the ones trained to necessarily give the advice and walk things through, and I think they're often the confidant, if you will. I'm wondering about everything from cradle to grave here in terms of recruiting and attracting the right talent within our organization to be those champions, because it does take a certain type of individual to do that. You can't have someone who's walking around like the Daily Mirror saying, guess who's come and spoken to me, blah, 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 blah. But by the same token, you need someone who's, literally there, who's almost a trusted partner to your workforce and your teams. So what I'm asking is, the question is there a kind of a training pack, a recruitment pack, a literal complete package that we can identify, download, and start reviewing? And then afterwards, as my peers at Alpha have said, look, let's get people on the right training course to make sure that they're equipped effectively to handle something. And we all know that when you have union reps in organizations, they are pulled away from business as usual because they're constantly defending naughty people or not naughty people. They're constantly pulled away from the front line because they've got to represent their team. And I think it's about managing these champions to make sure that they're balancing, I think it's probably the right word to use, the right the right time and resource. And I guess the follow-up question is, what support do we need to give those champions who may well be coming across very difficult circumstances, trauma potentially, to support them so that they don't get burnt out when they're the ones trying to, frequency check the rest of the team. Sorry, quite a lot there, but hopefully you've got the gist.
Yeah, no, I certainly think you're speaking to something that does come with, it is, I think, a privilege to have that role, but also a challenge. And there is a dual aspect to it there of certainly of supporting people, but also perhaps a carrying of something that might be to do with the individuals, but also to do with what's happening in a team. I'm certainly happy to share some information about the Wellbeing Champion training that we have. I'm happy to get in touch with you and share the information. And certainly, I would say when it comes to, I think it's a really good thing to think about and prioritize the well-being of those people in teams. And that's a really nice thing to be aware of. They can seek support, obviously, from our services if they feel that their role does come with, as you said, perhaps a discussion around difficult things or trauma that they might want a space to think about and process. But I think as you're already doing, and being thoughtful as managers about what they might be exposed to, what the role might be demanding of them, and kind of regular check-ins around that, I think is really, really important. But I'm happy to share the information and have a discussion around that as well. Yeah, really, really important one. Thank you.
Can I add into this slightly, Karim and Barinder? It's quite interesting with a lot of the work we started out similar, where we had lots of offers available. What we found was really valuable was actually arranging, for example, a session in the working place, and a lot of staff came there. Actually, it gave a lot of people the ideas, the thoughts of what to say and how to move on, because what you find is, as you said, you can provide champions, but then it can be quite daunting of trying to support the staff. Actually, someone coming into your service, sitting down with the team, they have a more of an understanding of what that would entail. And it really helps and lends to what happens going forward. I know in social care, almost it's like to download sort of like a training pack. I think what I found, and one of the most important things that when in doing a lot of the sessions, where staff just said, no one's just given us time just to listen to us. And I think it's just more having that space just to be listened to. So they're actually sort of having a free sort of expression of what they've felt, what they're going through, and their main concerns. So I think it's valuable, yes, to definitely download the information, have a champion, but actually arranging a session, staff actually really appreciate that when that happens.
Yeah, I think there's a lot that can be said for a physical space to kind of share and speak. And the thing that comes to mind for me is when we're kind of talking about the issues that, for example, a champion might face, a wellbeing champion as managers supporting that person, is boundaries. And I think a reminder of boundaries and limits that role encompasses. There may well be, what was mentioned, a certain type of person taking on a certain kind of role. It may well be that someone who is already willing to do a little bit more, take on a little bit more, might put themselves up for that role. And I think as managers, it can be really, really helpful to remind that person of what the role does and does not expect of them, and what their limits are in terms of their capabilities in that role, and what's okay to kind of to not do, and to leave with the other person, and to leave it in the role, essentially. And I think as managers we can do a lot around that in kind of that discussion around boundaries, expectations, and maybe just acknowledging what it is they might be you know, their own expectations of themselves in that role too. And I think that can certainly come up a lot, and I think a space to discuss that is really, really valuable as well.
I think it's a very good point, and Carrie made some very interesting observations about the use of champions, and indeed the use of trade union officials. And LCaS has done a series of work with both South East London Keeping Well and North West London Keeping Well, as you know, with managing stress training and various other things. And one of the negative points and a positive point that has come back from both of those, we were asked for further support for people who had become interested because they'd picked up the basics. And over the years that we've been involved with social care, we have come through a lot of championship schemes. The point that Karen made very effectively was that often people are trained to be champions. They're then expected to do that at the same time as the other 9 jobs they're doing. They're not given any space or any further training or support. And if people are going to get involved in things like mental health champions, then that can be quite wearing on them personally, and they do need that support. And it's the same, you know, we have seen, going back over the years, complaints about championship schemes, be they dementia champions or hydration or whatever it is. Oh, they didn't work properly. Well, the key reason they didn't work properly was 2 things. One, the companies just sent somebody because it ticked a box to have a champion. And secondly, that champion wasn't allowed to do the championship role. And organizations, and this comes back to culture, which was the point of today's meeting, the culture of that organization needs to be such that staff are supported. And if they have what is a very important role as a champion of, say, well-being or dementia or nutrition, whatever it is, that the organization, the owners, the managers, such as Kareem, actually support them to do that and give them time to do the role well. And Dudley has done a lot of work, you know, following this up with in South East London, and come up with some very interesting statements. And it has a great knock-on for organizational profit, because if people are supported, they stay in post, they don't leave. And recruitment is a hideous cost.
I'm sorry to add as well, I think the other wonderful, valuable tool is that local authorities and CQC do like to see the mental health and well-being of the staff. It's now, we know, one of the big factors that comes up with staff well-being. So if anything, try and utilize it. CPDs, support, actually is part of what you're doing in your working environment. It's really helpful as well.
Yeah, absolutely. Any other points for Barinder, or we'll move on to skills for care? Seems not. Thank you very much, Barinder.
Thank you all. Thank you.
And Selena.
Hi everyone. So for those of you that don't know me, my name is Selena Doherty and I work for Skills for Care. And we are an organisation that supports the care workforce and management. And I cover North West London. So I cover the 8 London boroughs in the northwest of London. And I have been working with Keeping Well now for the last couple of years, since they've been funded to provide this amazing service. What I would say is Peter and myself do quite regularly send messages on WhatsApp about the latest thing that Keeping Well are offering. Please, we send it on WhatsApp to make it easy for you to forward to your staff. So if you do have staff WhatsApp groups, or it's easy to pop over a message to them, please do, because what we find is quite often if we send an email, it gets lost in the inbox. So we try and send things on WhatsApp so that you can forward it easily to your staff. We're kind of dependent on you guys to pass the messages on. And in terms of what's been said already, We do have we do rely on you as managers to give us intelligence about what's happening in your organisations, the challenges that you're having, anything that's going on for you that's particularly hard or going particularly well. Because we are funded by the Department of Health and Social Care as a charity to provide resources for you. If we get the intelligence, we forward it straight to Department of Health and Social Care, which influences the kind of funding streams and resources that we can provide for you. So please keep in touch with us, keep in touch with Keeping Well. We've had a couple of fantastic sessions in Northwest London with staff teams where they've experienced trauma or they've had a difficult situation to deal with, and Keeping Well have come along to their teams and done a couple of sessions with them, trauma debriefing or just, you know, coping with stress, and it's gone down really, really well. So don't forget you have that resource as well that you can use Keeping Well for, as Barinder rightly said. Okay, so I'm going to share my slides. Don't worry, this is more an aid memoir for me, but information for you, which will come to you after the meeting. I'll just pop this into slideshow. Sorry, bear with me a moment. Go away, go away, go away. Oh, I can't get rid of the top bit. Hang on. I think is that what happened to you, Barinder? You couldn't get rid of the top bar.
Yeah, mine just wasn't going into slideshow, so I gave up.
Yeah, it's not going into slideshow. Not to worry. Can everyone see that okay? You can see it all right. Yeah. Okay, great. So updates from Skills for Care then. We do have, you know, every week we've got something new going on. So just to give you some information on what's new and what's happening. So during May, which is finished now, but we have just had a spotlight on integration and understanding integration, health and social care integration. And we've got some videos, we've got resources, we've got information to help you understand a bit more about integration. So it is one of those areas that, you know, we really want, there we go, done it. That we really want you to be a bit more involved in integrated care systems in Northwest London and all over the country tend to be very health dominated, and we really want social care to be more involved. We want you to have more of a voice in those integrated care systems so that you can help to influence the kind of funding and resources that go to you from the ICS. So we've put some information on our website, and we've also put some videos to help you understand. I'm also trying to get people from the ICS to come along to these meetings to talk about integration and how you can be more involved. We've just produced a new resource about delegated healthcare activity. So if you are finding that you're being asked more and more to do healthcare tasks with your service users, we've provided some principles and guidelines on how to make them safe and effective and person-centered. So that's a new resource from us. Now, we do appreciate that you are being asked more and more to do health type tasks, and your staff are being asked more and more, and this just gives you some guidance to make sure you're not doing things you shouldn't be doing, or to make sure that you're able to say and have a voice in what it is you can do and what you have the ability to do in terms of sort of minimum healthcare tasks. So that's quite an important resource that we would really like you to have a look at. So we have the Department of Health and Social Care have asked for information about if you're recruiting internationally and your international recruits. So if you can just share that email address with them, they would like to be able to communicate and support international recruits into social care organisations. So there is just an email address to pass on if you are having international recruitment. For those of you that are nominated individuals for your organisation, we've produced a new handbook, which is a practical guide to support you to do your role as nominated individuals. We do occasionally have nominated individual events as well. There's another one coming up later in the year that you can go along to and share as nominated individuals, share best practice and have information. We've updated our good and outstanding toolkit for CQC. So it's an upgraded version of the inspection toolkit, and to understand the changes that's coming in the way that CQC inspect. We have had CQC come along to most of our North West London network meetings now to talk about the new framework. But if you're still a bit fuzzy about it, do have a look at the new good and outstanding care. But we will also be adjusting all of our CQC resources to support you with the new inspection framework. So don't worry, there'll be more coming out. So this is something that I feel very, very passionate about, because when I was working in social care many years ago, we didn't have anything like this. But it's new training resources to help you support personal relationships between service users. So we have a new slide pack and also some materials that you can have a look at and take back to your staff teams about personal relationships and sexual relationships. And this is something that, you know, it was always a bit of a stigma. It was always something that was never talked about in social care, that, you know, people with learning disabilities, older people, anybody that, you know, we're working to support, have relationships and want to have relationships. So this is a really fantastic new resource that you can use, have a look at and use and take back to your staff teams. We've got an upcoming webinar on the 6th of July about culture. So I know today one of the themes was going to be about culture. Skills for Care do a lot of resources on how to foster positive cultures within your workplace, as we know that, you know, you can have one negative person in the staff team that can bring down the whole culture of the staff team and bring down the positivity. And it also talks about relationships. You know, it's really important to understand different skills within the team and how to make best use of them. You know, we were talking earlier about champions and how to motivate staff by, you know, getting them involved a bit more in developing training or becoming champions within your teams. But the webinar that's coming up is all about, you know, fostering positive cultures and how it supports performance, well-being and so on within your team. So have a look at that. But we do also have a lot of resources on culture, so you can have a look at those as well. We've also got a webinar on the 27th of June about succession planning. So this is something, again, that, you know, we don't really think about in the day-to-day business of caring, but it is really, really important. We know that we have an aging workforce as well as an aging population. You know, the average age of workers in social care is 45 plus. And we really need to be thinking about succession planning when people are coming up to retirement. Yourselves as managers might be thinking about moving on or moving into different roles, and how you think about, you know, training people and working with people to take the place of those who leave. We had a deputy manager network last week. We had 40 people attend that, and we talked about training and development and the importance of learning and development and how it helps to retain staff. Succession planning is another one, you know, thinking about building staff and motivating staff to perhaps step into those roles that people may leave. So this is a new webinar that's coming out. I mean, we have lots of webinars on our website now that we've done in the past and that we've recorded for you to have a look at. And it's all training and development, it's all CPD for you. But we have 2 new ones, providing evidence to the CQC and the new CQC inspection. So as I said, if you missed CQC coming along to one of these meetings, then you can have a look at these webinars. So I mentioned the nominated individual event. That's on the 29th of November. So you can have a look and book that online. But we also have the recording of the last one. So you can actually listen to that if you would like to. We have a new supporting the development of leadership skills. So again, as managers, you know, I know you're very, very busy people and you're involved in the general organisation of your workforce and your organisations, but it is also important that you do your CPD, that you think about leadership skills, that you think about developing yourselves and also your future leaders. So thinking about your deputies and aspiring managers. So this is a new guide to supporting the development of leadership skills. All of the slides have got links on them, so you don't have to go delving into our website. You can just click straight on the link that I've given you. Okay, we've got new resources to support culturally appropriate care as well. So this is really good. And this was quite a long time being built to make sure we really got it right. But it's all about topics about how to be sensitive to people's cultural identity and heritage. So when you're working with people, you really do have that person-centered care when it comes to culture and heritage as well. So this is a brand new resource that we launched recently, and it's a really, really nice one, this one. We've also got, if you haven't heard of the Better Hiring Toolkit, we have launched this recently as well, and this is something that Skills for Care did in partnership with other organisations to help you to really think deeply about the people that you recruit, how to recruit them safely, how to really think about DBS, and we know that there's been changes to the DBS system recently, and how you think about safe and fair recruitment. So we had what we call a roadshow last week at the Gatwick Holiday Inn. I don't know if any of you were able to attend that. We had 85 provider managers come along to that, and we talked about, we had a session on the Better Hiring Toolkit, and we had a session on, you know, what you don't see in a DBS. And what you don't see when people come for interview, or what they may not disclose, or, you know, people's backgrounds, and also thinking outside the box. So thinking about people that you may not be thinking about recruiting, who have barriers to recruitment, and how you can safely recruit people with risk assessment that may have a background in addiction or mental health, mental poor health, who are trying desperately to get back into the workplace, people who may have a criminal record from way back that they can't, you know, blot on a copybook that they can't get rid of, but thinking a little bit outside the box about how you can broaden your horizons with recruitment and recruit people who you may not be immediately thinking about, and how wonderful they can be within your teams. And this guide is all about helping you to do that. There's also loads of templates in there. So if you're thinking about updating your recruitment templates, i.e. references, and you want some help to think about updating some of your recruitment resources, then we've got loads of templates in there as well. We've got another fairly new resource called Top Tips for Adult Social Care Retention. And this is aimed at, you know, you to support you with thinking about how to improve your retention and all the kinds of wonderful things that you do already, and also some new ideas about how to retain the staff that you've got. We've got, so for those of you that haven't looked at our training and qualifications pages for a while, we've updated them now. Just to follow on from sort of thinking about funding, we do have our workforce development funding. If you are not on the adult social care workforce data set, please sign up to it. It's very easy to do. I can talk you through it. Any of us can at Skills for Care. Because if you're not, you're missing out on funding for training and qualifications, and you can claim up to £2,000 a year for any one member of staff. If you've put them on training courses, you've got certificates, you can claim. Karim, you were asking earlier about training for people to become mental health wellbeing champions. We have added mental health first aid to our list of training that can be claimed back for. So if you are thinking about getting people trained in that kind of area, then we have mental health first aid. and you can claim that on the workforce development funding. So please, please, I cannot encourage you enough to get onto ASCWDS. And there's a link there to help you to create a login. It's very easy to do, to add your workforce, and then you've got access to funding for training and development and qualifications. So we've got another, well, following on from that, on Wednesday the 7th of June, there's a webinar on how to do it, basically how to get onto the workforce data set in order to be able to claim the funding as well, and to understand the benefits of it. So all the information you put on about your workforce is completely confidential to us. It basically gives us an algorithm that provides statistics to us about the workforce and what's happening out there with staff. And then we use that to hopefully influence the Department of Health and Social Care to keep on giving us money, basically, to provide a service to you, and to give them a picture nationally of what's happening in social care and how important it is that social care continues to be funded in the different areas that it's being funded in. And, you know, it's a good way of keeping a good records about your staff training records, and so on. CQC love it as well. CQC want to see that you're on this, okay? So we also want to understand what workforce wellbeing initiatives work for you. So we'd really like to hear from you if you've got some really nice wellbeing initiatives that you're doing within your staff teams. And I do ask about this at the different networks that we do in Northwest London. We've got 6 different networks in Northwest London, and people have some wonderful stories about the kinds of initiatives they do at work to keep staff happy and to keep staff motivated and to keep them full stop. So we do hear lots of wonderful stories, and we would like to hear from you directly. If you can click on that link and just tell us about what you're doing, that would be amazing. Okay, so that's me, and Laura also supports this network. So there's our information and our phone numbers. Please use them. We are here to support you. I've only given you a snapshot of the types of support that Skills for Care provide for you. There's lots and lots of other stuff on our website. We have a dedicated registered managers page, which is full of information, and please use it. But if you're not sure about something or you want more information, just call me. Just literally pick up the phone and call me, or drop me a WhatsApp message if you're on our WhatsApp groups, or drop me a line on email. We do ask you to join the WhatsApp group for Northwest London for this network, because we do post information as soon as we hear it, whether it's information from the government, if it's something new we're doing, we put it on the WhatsApp groups, because we know that it's nice and quick and easy for you to read rather than clogging up your inboxes. So if you're not on our WhatsApp group, drop us an email, or, you know, just send me a text and I'll add you, or Peter or Dudley will add you on as well. I think that's it from me, Peter.
Okay, thank you very much, Selena. There's a huge amount of information there, and I can only, you know, reiterate that the Skills for Care website and the newsletter gives you lots and lots of useful things. Though I've got a few points to make. I just, if it goes dead, I see the BT people have turned up across the road. The last time they came, they managed to cut off both phone lines and the internet, and didn't seem to think that's what they were doing there. So if it all goes black, my apologies. Any questions for Selena about Skills for Care? And I would also, any questions about Workforce Development Fund, because we do encourage you to join that. It's a fantastically useful resource for training. Anything?
I see that Mabel came to the Gatwick event. That's great, Mabel. It was good fun, wasn't it?
Yeah, we've had a few people put their details in the chat already, so I'll organise the WhatsApp from those.
Can I make a quick point, Peter? Sorry about that.
Yep, no problem.
It's quite interesting with Skills for Care and the offers that they provide. I think sometimes it can be quite overwhelming with so much that's there and you don't know where to start. I think as providers, I think the first and foremost, most things are free or can be supported with funding in some shape or form. And also Skills for Care have an expert knowledge in each field. So even if you're not sure of any area, you can actually go into it and actually ask either Selena or ourselves, and they can signpost you to any support you may need in any area. I mean, these are some of the areas that Selena's obviously mentioned, but they cover everything from managers support, chairs, all the way down to auditing. And there's also videos as well on their website as well on how to do templates, which probably is one of the most important things when we think about our services. It's about the templates, which are really important. So I think all of that is there at hand. I think sometimes it's just a case of just literally maybe if you have an issue or point, type it into their website. I know it can be quite a lot. And if you're not sure, then by all means do get in touch with Selena
Ring me
or ourselves that are here. I think it's such a big thing that's been missed by most providers whenever they go out and they're paying for sort of training and funding for various things. Actually, Skills for Care is probably one of the first ports of calls I would start with.
But also, Dudley, we've all most of us at Skills for Care have worked directly in Skills for Care. So my entire career has been frontline social care, right up until a few years ago when I went into workforce development. So we've been where you are. We know the job. We know the challenges, we know the issues. And, you know, I had a manager call me this morning to ask about a training provider and how they hadn't heard from them and they'd paid for this training and it hadn't turned up and da 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 da. You know, we get so many different queries about absolutely everything. And if we can't help you, we'll know someone that can. So please, just as same with the LCaS forum, you know, we're there to support you and answer your questions, and nothing is a silly question. So do feel free to pick up the phone. You're not bothering us. That's what our job is.
As part of training, you need decent internet access for your business. And a lot of work has been done on the internet network with fiber, etc., directed to location. So there's been many deals. Now, what we've found is a lot of people have signed up for the cheapest deal and they have internet that keeps dropping out, which is not very much use. So cheapest is not best. What you need is internet that works. You also, if you haven't already, sign up to DSPT because you need to get yourself an NHS email address. You need to be aware of what's happening with changes to software, to the use of NHS approved software. If you need information about DSPT, if you haven't already been bombarded with it, let us know. We will put you in touch with the people that can resolve those issues for you. But you do need decent internet to be anywhere. If you want to us to sign you up to WhatsApp, that's great. We'll do that. Please let us know which boroughs you work in. That is essential, and then we can get you into the right WhatsApp group. Our next meeting is the 14th of June, and that's with Mick Feather from Citation, who's always popular, rather, and that will be about CQC. There'll be lots of information there about the changes to inspections and how to maintain quality standards. Again, that's a virtual meeting. The meeting that would have been today with Culture is likely to be on July the 19th. And I would just reiterate, those of you in the South West London boroughs, if you want some support, it's free on recruitment. Please let us know. Again, we need to know who you are, where you are, and a phone number. And we will be in touch. And that's working with, it's on Skills for Care money, and it's working with Purple Tribe. And I think that's all from me. Anything from you, Dudley?
No, thanks very much, everyone. I know it's been a very interesting month. We've had 3 bank holidays and a new king crowned and so much going on. But unfortunately, social care is still with us. I'm also very conscious as well. We're coming into that month of June. I know July and half of July and August can be almost seemed as a dead month because a lot of people are away on holiday and so forth. But don't forget, social care doesn't stop. So whatever support you can get or advantage you can have, please do, because September comes thick and fast, and then the run down to the end of the year, and so many things are there. So try and, if anything, do your planning strategy. Is a good time to sort of sit down when there's a bit of downtime, not as many events going on. So please do that. And the other thing as well, in regards to the WhatsApp group, I've been running the WhatsApp group for, it must be a good 4 to 5 years. And what we found is that the WhatsApp group is a place where you actually can ask questions in the group, share information, lots of support. Someone will come back to you. It's not just waiting for the likes of Peter or myself or Selena or Laura. Actually, people in your group are probably local to you. So it could be anything like a good trainer, support. There's lots of people around, international workforce and so forth. So actually, there's a raft of knowledge amongst yourselves. So actually do use and utilize the platform in itself. I guess it's quite informal. And you can send a message most times and someone will come back to you within reason. So it's outside sort of working hours. So please do your best to utilize it and do talk to one another. I think that's the other thing that sort of like we should have learned from COVID, is that we all are in the sort of same boat of trying to help one another. So do talk locally and support one another across the board.
Thanks, Dudley. Great advice. There's a huge amount of information. If you look at the people in this room, the years of experience, tremendous amount of knowledge, share that amongst yourselves. They may be your competitors, but they're also colleagues, and a stronger social care is a better social care for everybody, not just those using it, those working in it as well. And as has been said before, please pass on information about services like Keeping Well to your staff. Selena, Barinder, Dudley, many thanks for your help this morning. Look forward to seeing you on the 14th. We will circulate the information. The recording will be on the website fairly shortly. Please, Dudley. And apologies that Social Works weren't able to join us this morning, but I think we've had a useful meeting anyway. All the best. Thanks now.
Bye.
Bye.
Thank you all. Bye.
Bye.